Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a rheumatologist talking to a patient called Mr. Stewart. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Stewart. I see that your primary care physician referred you to me due to some concerns regarding muscle weakness and a rash that you've been experiencing. Could you tell me a bit more about your symptoms?
Yes, I've been feeling really weak, especially in my arms and thighs. It's been getting worse over the last few months. And then there's this rash that showed up on my face and hands. It's red and kind of scaly. At first, I thought it might just be eczema or something, but it doesn't go away, no matter what I try.
I see. That must be quite challenging. When did you first notice these symptoms?
The rash started about 6 months ago, and the muscle weakness followed not long after. I thought it might just be stress or something, but it's been getting progressively worse. And now, even simple tasks like getting out of a chair or lifting my arms to wash my hair are difficult.
It sounds like you're describing symptoms consistent with a condition called dermatomyositis. It's an inflammatory disease that affects the skin and muscles. The muscle weakness you mentioned, particularly in your proximal muscles like those in your arms and thighs, is a hallmark of this condition. And the rash, especially on the face and hands, is also typical.
Dermatomyositis? I've never heard of that. Is it serious?
It can be serious if left untreated, but with the right management, many people live well with it. The cause of dermatomyositis isn't fully understood, but it's considered an autoimmune disease, meaning your immune system is mistakenly attacking your body's own tissues.
That sounds pretty scary. What causes it to happen?
It's not entirely clear what triggers dermatomyositis, but it can be associated with certain infections, medications, or even cancers. However, in many cases, the exact cause remains unknown. What's important is that we focus on managing your symptoms and slowing the progression of the disease.
So what are the treatment options? Is there a cure?
While there's no cure for dermatomyositis, the symptoms can often be managed effectively with a combination of medications and physical therapy. We typically start with corticosteroids to reduce inflammation. In some cases, we also use immunosuppressants to help control the immune system's activity.
Corticosteroids? Aren't those pretty strong medications? I'm worried about the side effects.
They are potent, but they can be very effective in controlling the symptoms of dermatomyositis. That said, long-term use of corticosteroids does come with potential side effects, such as weight gain, high blood pressure, and increased risk of infections. That's why we usually try to taper the dose as soon as possible and might introduce other medications to help reduce the need for steroids.
And what about the muscle weakness? Is that something that can be reversed?
With treatment, many people see significant improvement in muscle strength. Physical therapy is crucial in this regard. It helps maintain muscle function and can even help regain some of the strength that's been lost. It's important to start therapy early and be consistent with it.
What about the rash? Will that go away with treatment?
The rash can improve with the same treatments used for the muscle symptoms. In addition to corticosteroids, topical treatments or other medications that target skin symptoms may be used. Protecting your skin from the sun is also important, because UV light can worsen the rash.
I guess I need to be more careful about sun exposure then. But what if the treatments don't work?
It's true that not everyone responds to treatment in the same way, but there are multiple options we can try. Sometimes it takes a bit of time to find the right combination of treatments that work for you. In more severe cases, we may explore other therapies like IVG intravenous immunoglobulin, or biologic agents that target specific parts of the immune system.
It sounds like it's going to be a long road. How do I manage day-to-day life with this?
Managing a chronic condition like dermatomyositis does require adjustments, but with a good treatment plan and support, you can continue to live a full life. It's important to listen to your body, balance activity with rest, and stay on top of your treatment. Regular follow-ups with your healthcare team will also help us make any necessary adjustments to your care.
I'm glad we're catching this now. It's a lot to take in, but I feel better knowing there's a plan.
Absolutely. You're not alone in this. We'll work together to manage your symptoms and improve your quality of life. Let's start by arranging some tests to confirm the diagnosis. And then we can discuss the best treatment options for you.
Thank you, Doctor. I appreciate your help.
You're welcome, Mr. Stewart. We'll take this step by step. Let's get started on your road to managing this condition.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mr. Grant. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, Mr. Grant. I'm Dr. Elias, one of the physicians here at the hospital. I've come to discuss your current symptoms and understand what's been going on. Could you start by telling me why you came in today?
Hi, doctor. I came in because I've been feeling really unwell, feverish, weak, and my heart has been racing for the past couple of days.
I'm sorry to hear that. When did these symptoms start?
It started about 3 days ago. I initially thought it was just a bad cold, but it kept getting worse.
I see. Did you notice anything unusual before these symptoms began, like an infection, cut, or any other illness?
Yes, actually. About a week ago, I had a small cut on my leg from working in the garden. I cleaned it up, but it got red and swollen after a few days.
That's important to note. Did you see any discharge or pus coming from the cut?
Yes, it started leaking some yellowish fluid 2 days ago, and it's been painful to touch.
Okay, and besides the fever and weakness, have you had any other symptoms, such as chills, confusion, shortness of breath, or a rapid heartbeat?
Yeah, I've been shivering a lot, and yesterday I got really confused. I couldn't even remember where I put my car keys, and that's not like me. My heart has also been racing, and I've been breathing faster than normal.
Those are concerning symptoms. Have you noticed any changes in your urine output, like going less frequently or dark-colored urine?
I haven't really been drinking much water because I've felt so nauseous, and I haven't needed to go to the bathroom as much.
Thank you for sharing that. Let's talk a bit about your past medical history. Have you ever been hospitalized for any major illnesses or surgeries before?
I've had high blood pressure for years, and about 5 years ago, I had my gallbladder removed. Other than that, I've been relatively healthy.
And are you currently taking any medications, including over-the-counter drugs or supplements?
Just my blood pressure medication and a daily multivitamin.
All right, Mr. Grant. Based on your symptoms, fever, chills, rapid heart rate, confusion, and the infected cut, it seems like you might be dealing with sepsis, which is a severe reaction to an infection in your body. Have you ever heard of sepsis before?
I've heard the term, but don't really know much about it.
Sepsis happens when your body's response to an infection triggers inflammation throughout the body, which can lead to tissue damage and organ dysfunction if not treated promptly. In your case, it looks like the infection from your leg wound might have spread into your bloodstream.
That sounds serious. How do we fix it?
It is serious, but we are on it. The first steps are to confirm the diagnosis with some blood tests, which will help us check for infection markers, your organ function, and overall severity. We'll also start you on broad-spectrum antibiotics to fight the infection, and we may need to give you fluids through and for to help stabilize your blood pressure and support your organs.
Is there anything else I need to be aware of?
We'll be monitoring you closely. The key is catching it early, which we've done, so we are already ahead. We might need to adjust the antibiotics based on the results of your blood tests, and if necessary, perform further imaging to check for any abscesses or areas that might need surgical attention. Have you experienced anything like this before?
No, this is all new to me. I just thought I'd feel better after a few days, but it's been getting worse.
It's good that you came in. Sepsis can escalate quickly, but with prompt treatment, many people recover fully. Do you have any questions or concerns about the treatment plan?
I'm just worried about my family. I don't want this to get worse.
That's completely understandable. We are taking every measure to ensure that you get the best care. Once we get you stable and on the right medications, you should start feeling better. I'll keep your family updated as well.
Thank you, doctor. I appreciate it.
You're welcome. We'll do everything we can to help you recover quickly. Let's get started with those tests and treatments now. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse talking to a patient who has just been diagnosed with high blood pressure. Now read the question.
So, we've gone through your results, and it looks like your blood pressure is a bit higher than we'd like. How are you feeling about that?
I'm a bit surprised, to be honest. I didn't think it would be an issue. I mean, I don't feel any different, no headaches or anything like that.
That's common. High blood pressure often doesn't have obvious symptoms. But it's important we manage it to avoid complications.
I'm worried about taking medication. Will I have to be on it for the rest of my life?
Not necessarily. With some lifestyle changes, we might be able to manage it without medication, or reduce the dose over time.
I'll try, but I'm still a bit nervous about what this means for my health long term.
It's understandable, but we'll work together to keep everything under control.
Now look at question 26. You hear a doctor talking to a nurse about a patient. Now read the question.
Last time she was here, she mentioned that lying down in a dark, quiet room with some anti-nausea medication really helped. But right now, she's in a lot of discomfort and is having trouble relaxing enough to do that.
I see. Given her history and current symptoms, do you think we should start with some IV fluids and anti-nausea medication to help manage her condition?
Yes, I think that's the best approach. We can start with the fluids to keep her hydrated, and the anti-nausea medication should help alleviate some of her symptoms. Once she feels well enough to rest, we can reassess her condition and see if she's comfortable enough to stay in a quiet room.
Agreed. We'll monitor her closely to ensure the treatment is effective and adjust as needed. Let's get her started on the IV and medication right away.
Now look at question 27. You hear a nurse and a patient discussing the administration of an insulin injection. Now, read the question.
Let's go over the steps for your insulin injection. What's the first thing you should do?
I need to wash my hands thoroughly and clean the injection site with an alcohol swab. After that, I'll prepare the insulin by gently rolling the vial between my hands to mix it evenly.
Excellent. And when it comes to the needle, what's important to remember?
I should always use a new needle for each injection and make sure to inject at a 90-degree angle. I'm just a bit unsure. How long should I hold the needle in place after injecting?
You should hold the needle in place for 5 to 10 seconds to ensure that all the insulin is delivered into your body. And once you've completed the injection, what's the next step?
I need to dispose of the used needle safely in a sharps container and then monitor my blood sugar levels to ensure everything is within the target range.
Now look at question 28. You hear a medical professional explaining about electronic health record. Now read the question.
Now, you'll have received the proposal regarding the introduction of new electronic health record, EHR systems, and I'm sure you've got your own thoughts about how this might affect your day-to-day responsibilities. You're probably aware of the evidence suggesting that EHRs can significantly improve patient care by providing quick access to patient history and reducing errors. There's no doubt about the potential benefits here, but we understand that you might be concerned about the learning curve and additional time needed to adapt to the new system. That's why we've ensured that the transition will be as smooth as possible. Comprehensive training sessions will be provided, and technical support will be available around the clock to assist with any issues. We've also scheduled the rollout in phases to allow you to adjust gradually, without overwhelming you or disrupting your routine. Managers will be closely monitoring the process to address any concerns as they arise.
Now look at question 29. You overhear two clinic coordinators discussing patient follow-up for a new wellness program. Now read the question.
We've only managed to follow up with about 35% of the patients who signed up for the wellness programs so far. It's concerning because we're way behind on our target.
Less than a third of the patients, and the program requires us to complete follow-ups with all of them by the end of next week. Should we consider sending out another batch of reminder letters to get their attention?
We've already sent 3 rounds of reminder letters. I've even tried calling several patients personally to ensure they're aware, but the response rate is still low. I think we need to address this during our next clinic team huddle to figure out a different approach.
That's scheduled for Monday morning, right? Do you think that timing will work for everyone on the team, or should we consider another time?
It should work since the team huddle is already on everyone's calendar, but if anyone can't make it, we can arrange a brief individual meeting with them to ensure they're updated.
Now look at question 30. You hear a dietitian talking to a patient who's just been diagnosed with type 2 diabetes. Now, read the question.
It seems your blood sugar levels are higher than normal. How are you feeling about making some dietary changes?
I'm a bit overwhelmed. I didn't expect this. I mean, I don't usually eat a lot of sweets or anything.
That's understandable. Diabetes can be surprising, and it's not just about sugar intake. It's important to focus on overall healthy eating to manage it. We'll look at the types of carbohydrates you're eating, portion sizes, and meal timing to help keep your blood sugar stable.
I'm concerned about giving up the foods I love. Will I have to cut them out completely?
Not necessarily. We'll work on creating a balanced meal plan that includes your favorite foods in moderation. It's about finding healthier alternatives and portion sizes that fit within your new lifestyle, so you can still enjoy what you love while managing your blood sugar levels.
I'll do my best, but I'm still anxious about maintaining this long term.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1, questions 31 to 36. You hear a doctor, Emily Thompson, giving a detailed presentation on hypothyroidism. You now have 90 seconds to read questions.
Hello, my name's Dr. Emily Thompson. I'm an endocrinologist, and today I'm going to talk about a condition called hypothyroidism, a common disorder that affects the thyroid gland. The thyroid is a small, butterfly-shaped gland located at the base of your neck, and it plays a crucial role in regulating your metabolism. Hypothyroidism occurs when the thyroid doesn't produce enough thyroid hormone, which can lead to a range of symptoms that may develop slowly over time. Many people with hypothyroidism are unaware that they have the condition because the symptoms can be subtle and are often attributed to other causes. The most common cause of hypothyroidism is Hashimoto's thyroiditis, an autoimmune disorder where the immune system mistakenly attacks the thyroid gland, leading to decreased hormone production. Other causes include surgical removal of the thyroid, radiation therapy for cancer, and certain medications. Hypothyroidism is more common in women, especially those over the age of 60, and it tends to run in families. It's also associated with other autoimmune diseases,
such as type 1 diabetes and rheumatoid arthritis. Symptoms of hyperthyroidism can vary widely, but some of the most common include fatigue, weight gain, cold intolerance, and dry skin. Many patients also experience constipation, depression, and memory problems. In more severe cases, hyperthyroidism can lead to a condition called myxedema, which is a medical emergency characterized by extreme fatigue, low body temperature, and swelling. However, with proper treatment, these symptoms can be managed effectively. Let me share a case I encountered recently. A 45-year-old woman named Karen came to see me complaining of fatigue, weight gain, and feeling unusually cold all the time. She had been experiencing these symptoms for about a year but had attributed them to getting older and the stress of her job. However, when I examined her and reviewed her medical history, I suspected hyperthyroidism. We performed a blood test to measure her levels of thyroid-stimulating hormone, TSH, and free thyroxine, T4, and the results confirmed that she had hyperthyroidism. Karen's case is a good example of how hyperthyroidism can be mistaken for other conditions or simply attributed to lifestyle factors. Fatigue, for instance, is a common symptom of many different health issues, but in Karen's case, it was a key indicator of an underactive thyroid. Once we had the diagnosis, we could start her on the appropriate treatment, which involved daily hormone replacement therapy with levothyroxine. This synthetic hormone is identical to the T4 that the thyroid normally produces, and it helps to restore normal hormone levels. When treating hyperthyroidism, it's important to tailor the treatment to each individual's needs. For most patients, the goal is to normalize TSH levels with the lowest effective dose of medication. This often requires periodic blood tests and adjustments to the dosage, especially in the first few months of treatment. Patients also need to be aware that it may take several weeks to start feeling better after beginning treatment, as the body needs time to adjust to the increased hormone levels. In addition to medication, there are lifestyle changes that can help manage hyperthyroidism. A healthy diet is important, particularly one that includes sufficient iodine, which is essential for thyroid function. However, it's also important not to consume too much iodine, as this can actually worsen hyperthyroidism or even trigger hyperthyroidism. Regular exercise can help manage weight and improve energy levels, which are often affected by hyperthyroidism. Stress management is also crucial, as stress can exacerbate symptoms. Another case I'd like to mention is a 38-year-old man named James, who was referred to me after his primary care physician noticed an enlarged thyroid, also known as a goiter, during a routine physical exam. James hadn't noticed any symptoms other than some mild fatigue, which he attributed to his busy lifestyle. However, his blood tests showed elevated TSH levels and low T4 levels, confirming a diagnosis of hyperthyroidism. In James' case, the presence of a goiter was an important physical sign that led to further investigation. Goiters can occur in both hyperthyroidism and hypothyroidism, but in James' case, it was due to the thyroid gland working harder to produce hormones, which is typical in hyperthyroidism. Treatment for James involved hormone replacement therapy, and after several months of adjusting his dosage, his thyroid levels normalized, and the goiter gradually reduced in size. When managing hyperthyroidism, it's also important to consider the potential long-term effects of the condition. If left untreated, hyperthyroidism can lead to an increased risk of cardiovascular disease, particularly because it can cause high cholesterol levels. Women with untreated hyperthyroidism who become pregnant are also at risk of complications, such as preeclampsia, anemia, and even miscarriage. Therefore, early diagnosis and consistent treatment are key to preventing these complications. One of the challenges in treating hyperthyroidism is ensuring patient compliance with the treatment regimen. Because the symptoms of hyperthyroidism can be vague and develop slowly, patients might not realize the importance of taking their medication consistently. In addition, some patients may become discouraged if they don't see immediate improvements in their symptoms. That's why it's crucial for healthcare providers to educate patients about the nature of the condition and the importance of ongoing treatment. In summary, hyperthyroidism is a common but often overlooked condition that can have a significant impact on a person's quality of life. However, with proper diagnosis and treatment, most patients can manage their symptoms effectively and lead a normal, healthy life.
Regular monitoring and a personalized treatment approach are essential to ensuring the best outcomes for patients with hyperthyroidism.
Extract 2. Questions 37 to 42. You hear an interview of Dr. Eleanor Hayes discussing AI in primary healthcare. Now, read the questions. You now have 90 seconds to read questions.
As AI technology advances, its role in primary healthcare is becoming increasingly significant. There's a strong belief that AI could revolutionize how healthcare is delivered, potentially improving both efficiency and patient outcomes. I'm Greg Palmer, and today my guest is Dr. Eleanor Hayes, co-author of a recent article exploring the potential of AI in primary care. Dr. Hayes, what do you think the future holds for AI in primary healthcare settings?
Well, Greg, I think we're looking at a transformative period in healthcare. AI has the potential to handle a range of tasks, from diagnosing common ailments to optimizing treatment plans based on vast amounts of patient data. What we'll likely see is a gradual integration of AI into existing healthcare systems, with AI assisting healthcare professionals in making more informed decisions. This transition will require healthcare providers to adapt to new technologies while maintaining the human element in care, which is critical for patient trust and satisfaction.
That's fascinating. Could you elaborate on how AI might change the day-to-day operations of primary healthcare providers?
Certainly. One of the primary areas where AI will have an impact is in streamlining administrative tasks. For example, AI can automate appointment scheduling, manage patient records, and even handle billing processes. This could free up time for healthcare professionals to focus more on patient care rather than administrative duties. Moreover, AI-powered diagnostic tools can assist in identifying symptoms more quickly and accurately, allowing for earlier interventions and potentially better outcomes for patients.
It sounds like AI could significantly enhance efficiency, but how do you see the integration of AI affecting the patient experience?
That's a great question. The integration of AI in healthcare could greatly improve the patient experience, especially in terms of accessibility and personalization. AI can analyze a patient's medical history and preferences to tailor care plans specifically for them. For instance, AI could suggest lifestyle changes or medication adjustments based on real-time data. However, it's crucial to ensure that the implementation of AI doesn't compromise the personal touch that patients value. The challenge will be in balancing AI's capabilities with the need for empathetic, human-centered care.
AI is often seen as a tool for enhancing healthcare, but are there any concerns or limitations that you think need to be addressed?
Absolutely. While AI offers many advantages, there are also significant challenges that need to be considered. One major concern is data privacy and security. With AI systems relying heavily on patient data, ensuring that this information is protected from breaches is paramount. Additionally, there's the issue of bias in AI algorithms. If the data used to train these systems isn't diverse enough, there's a risk that the AI could make biased decisions that don't fairly represent all patient groups. Lastly, there's the need for healthcare professionals to be adequately trained in using these tools. Without proper training, the benefits of AI could be undermined.
Those are important points. In your article, you mentioned that AI could also play a role in preventive care. Could you explain how that might work?
Certainly. AI has the potential to shift healthcare from a reactive model to a more proactive one. By analyzing patterns in patient data, AI can predict potential health issues before they become serious, allowing for early intervention. For example, AI can identify risk factors for chronic diseases like diabetes or heart disease and recommend preventive measures. This could include lifestyle changes, regular screenings, or even early treatment options. The ability to predict and prevent health issues could be one of the most significant contributions of AI to healthcare, potentially reducing the overall burden on the healthcare system.
Finally, what advice would you give to healthcare organizations looking to adopt AI technology?
My advice would be to start small and focus on areas where AI can have the most immediate impact. Begin with pilot projects in specific departments or tasks, such as automating administrative functions or using AI for diagnostic support. It's also important to involve healthcare professionals in the implementation process, ensuring they are comfortable with the new technology and understand how it can enhance their work. Additionally, organizations should prioritize data security and ethical considerations, making sure that any AI solutions adopted are transparent and fair. By taking a measured approach, healthcare organizations can gradually integrate AI in a way that enhances care without overwhelming the system or staff.
That is the end of Part C. You now have 2 minutes to check your answers.